In this video, you can learn about the diagnostic agents. So basically, we are going to discuss in this video about the important uses of diagnostic agent. So let's see first X-ray contrast medium, which is also known as this radio opaque agent or the contrast medium. It is further classified into two classes. First, which is a soluble water soluble contrast medium. So in that water soluble contrast medium, which contain the pharmaceutical buffer, that is citrate buffer or the phosphate buffer, and it will be also contain the sequestering agent. Means what? The sequestering agent means what? That will be removal purpose. Then what is uses of water soluble contrast medium, which is used for the ureography and angiography. So what is ureography? It is nothing but the examination of ureter or the kidney. Then what is a angiography? It is nothing but the examination of arterial system. And this water soluble contrast medium is also useful for the visualization of heart, limb and bile duct. Then second class, which is a water soluble contrast medium. So this water insoluble contrast medium, which is a practically insoluble in water, hence their suspension are prepared. So what is use of this water insoluble contrast medium? It will be used as the cholecystography. Okay, so what is cholecystography? It is nothing but the examination of liver or gallbladder. Then it is also used for the bronchography, for the examination of bronchial tract as well as malleography. Let's see the examples. First, which is a hyaluronic acid, which is a iodine containing radio contrast medium, and this hyaluronic acid is given orally and that get well absorbed through the gastrointestinal tract, and it will be excreted from the fecal matter from our body. So what is use of hyaluronic acid, which is used for the cholecystography. So what is cholecystography? It is nothing but the X-ray examination of gallbladder, especially to detect the presence of gallstone. For means that hyaluronic acid useful for the to detect the presence of gallstone in the gallbladder. Then second one, which is a propyliodone. So what is propyliodone? Propyliodone is nothing but the iodine containing radio contrast medium, and it will be used for the examination of bronchial tract. Means it will be used for the bronchography. So what is bronchography? It is a radiological technique which are involve the X-raying the respiratory tract after the coating of the airway with the contrast medium. Means that propyliodone can be coat the respiratory tract airway. You can coat by using the propyliodone, and then you can done the bronchography, which is a radiological technique. Then let's see dyes, second one. So what are the use of dyes in diagnostic agent? These are used to detect the functioning of various body organs such as kidney, liver, cardiovascular system and gastrointestinal tract, etc. So this can be detect, or you can detect the functioning of these various body organs by using the dyes, and that dyes is classified into two class, which is a phthalate dye and azo dye. Let's see the examples, which is a sulfo-bromothalane sodium. Okay, what is a sulfo-bromothalane sodium? So this sulfo-bromothalane sodium is useful for the diagnosis of the hepatic disorder. It will be useful for the hepatic disorder. Means what? It is used to testing the liver function. So simply you have to remember the use of the sulfo-bromothalane sodium. Then let's see another one, which is a indigo carmine. This indigo carmine, it will be very important. So it is blue dye, means azo dye, used for the medical imaging of the measure the kidney function. Means what? Indigo carmine it will be useful for the detection of the kidney functions. So this injection of indigo carmine, which is used as a diagnostic agent for the testing of the renal function, to use to find uteral orifices during the cystoscopy and urethral catheterization. So what is a cystoscopy? That is the endoscopy of urinary bladder via the urethra. Okay, what is cystoscopy? It is the endoscopy done through the urinary bladder via urethra. And that's indigo carmine. It will be useful as a coloring agent in the laboratory. Let's see the another example of dyes, which is Evans blue. Okay, so what is use of Evans blue? Important uses. It will be used to determine the circulatory function. Then used for the determination of blood volume. So important use of the determination of blood volume. Also it can be if intravenously injected to determine, you can determine the plasma volume of the patient which are suffering from the heart failure, shock and other circulatory abnormalities. Means what? If any patient is suffering from the heart failure, shock and any other circulatory abnormalities, so you can inject the Evans blue intravenously and you can determine the plasma volume of this patient. Then another one, which is a important use of the Congo red. Okay, so you have to remember what is use of Congo red. It will be used as a stain in the diagnosis of the amyloid disease or the amyloidosis. So what is amyloid disease? It is a condition. In that condition, the protein that is deposited in the various body organs such as liver, kidney, spleen and any other tissues of certain diseases. In this certain disease, so various disease, in that disease condition you are having the protein molecule deposited in liver, kidney, spleen and any other tissues, so that condition are known as amyloid disease. Okay, so for detection of amyloid disease you can use the Congo red, and this Congo red is used as a indicator in the laboratory. Then last one, which is a important uses of the fluorescein sodium. So what is important uses of fluorescein sodium? It will be used as a diagnostic agent for the detection of lesion and foreign body in the ophthalmic practices. Means what? It is used to detect the disease or damaged area of corona. Then it is used to detect the foreign bodies in eyes. Also it will be used in the aid in the fitting of the hard contact lenses. Also you can use for diagnosis the dry eye syndrome. Okay, so this fluorescein sodium can be administered by mouth or the injection into the vein. So it may be used to help the evaluate the blood vessels in the back of the eyes and during the fluorescein angiography. So these are the uses of the fluorescein sodium. Then see this diagnostic agent summary. So you can remember this summary, diagnostic agent and their uses. So hyaluronic acid, firstly you have to remember, used for the examination of biliary tract. Then propyliodone, it is used to examination of bronchial tract. Sulfobromothalin, used for testing the liver function. Then indigo carmine, blue dye, used in the medical imaging to measure the kidney function. Then Evans blue, used for the determination of blood volume. Congo red, used to stain the diagnosis in the amyloid disease. Then fluorescein sodium, used in the diagnostic tool in the field of ophthalmology and optometry. It is also used in the ophthalmic practices to detect the corneal lesions and foreign body in the eyes. So this is all about the important uses of the diagnostic agents. Thank you for watching this video.